Yeah.
Okay.
Well, on this Memorial Day, we are looking closely at the strains of war as tens of thousands of troops serve in conflicts overseas. Families are left to cope with the difficult times while they're away, and often new stresses when they return. I'm joined right here in studio right now by Robert Lathers, the Chief Executive Officer of Ionia County Community Mental Health, to talk about some of the resources that are out there and why families should really take advantage of them. Thanks for joining us today.
Thank you.
We really appreciate it. So you are the father of an active Marine.
Right. My son's been in Iraq for 2 tours of duty.
Okay.
He's currently in the Marines. He's a corporal stationed at Camp Pendleton.
Okay. Tell us a little bit about what your family goes through having someone in Iraq.
It's been a pretty difficult situation because as a mental health professional, one would think that we are able to manage the turmoil of war and being separated from our children, but pretty much it's left to the families to find each other, to develop their own support systems, and to support their children while they're gone and their family members.
Talk a little bit about what resources are out there. What's already been established that's out there?
Right. Really, most resources for persons in the military, especially if they're not in the National Guard, are family-based resources where people connect with each other online, they connect with each other in support groups, they connect with each other because they know other people who are have children in the military, and most of the resources are peer support, family support, and one area that we try to focus on is to connect and make sure that we have as much information as we can regarding our children, where they're at, who's heard from them, and how can we be more in contact with each other for support.
I see. Do you think there's any weaknesses, I guess, to the resources that are already established?
Really, they're not connected as much as they could be for families. Families are often left, as I said, to find ways themselves to connect. Right. With the Michigan National Guard, they have an excellent program based basically in Lansing, and Brigadier General James Anderson is in charge of that. They do an excellent job both in Michigan and in the Montcalm and Ionia areas of connecting families. The other branches of service don't have as many resources or coordination for family members.
So what about a military family resource day?
Right.
What's that about?
Right. On Friday, May 29th in Belding at the Belding Bros Cafe, Montcalm Community Mental Health, Ionia Community Mental Health, the Veterans Administration, the National Guard, private therapists, other organizations, support groups are coming together to offer people what would be more or less termed as an expo to come together from 10 a.m. to 2 p.m. to learn about resources, how to be advocates for each other and for family members and for the military personnel that are returning from deployment.
So you're planning on bringing all of those resources together to talk about it, see how you can get them better
connected.
They'll
all be there to share information, and people be able to attend and find information and maybe get through some barriers that they've encountered to this point.
And learn more, I would imagine, from each other.
Right, and to find each other and to be able to support each other and to connect with each other, yes.
Okay. Robert Lathers, thanks so much for joining us. We really appreciate that. Coming up later in the hour, too, we're going to be talking about a very dark aspect of military life, the risk of suicide and depression, and Robert Lathers is staying around for that. He's going to talk about why those issues are on the rise, the warning signs, what needs to be done for prevention. That's all coming up at about 5:55. So thank you.